Thank you very much, all. So this is a talk that I'm calling the Housewife's Guide to Paper Writing. So in the chat box, what you can see is a Word document that you can just download onto your computer if you want, and kind of follow through, because it does go through the different components of paper writing and the different segments of the manuscript. And the lovely thing is that if it resonates with you, you can really make your own version. And what Kosha is saying is that they actually perfectionized this whole thing into a checklist, and he's also going to share this checklist with you. So thank you very much for having me, and thank you for finding it valuable to have this kind of presentation. So the reason I'm calling it a Housewife's Guide to Paper Writing is because I think all of us have really busy lives. We are in clinic, we have our families, we have an academic mandate, and I think for those of you who perhaps have not written a whole lot of papers, the situation that I was in when I came to Canada, I felt really intimidated. I felt intimidated by the idea that I have to follow a specific path, which I now call a cooking recipe, that then gets evaluated in the review process, and that I may be off target with this approach. So what I try to do is I try to put a recipe together that has the typical components of a recipe, namely, you know what you need to write the paper, and that is typically your data, that is typically the project that you just completed, the reason why you started it, and the impact that your project has, and that all needs to be captured in the paper, in the manuscript itself. But it also allows you to put a little bit of timing around the different segments. So what I oftentimes do is I conceptualize a paper, and then I kind of allocate days in my calendar. Literally, I got 2 hours and I can write the methods. I got 2 hours, I can, write let's say the introduction. Not that everything goes that fast, but you can allocate time in your life that is not a whole weekend or a whole evening or a whole week to write a manuscript. And I think you actually can get a really, really nice manuscript together. For me, it has worked for the past 20 years, and it sounds like it has for others. Everybody that trains with me gets this presentation right at the start, and gets a bit of a cooking recipe as to this is really how I want you to prepare the manuscript, and here are the touch points, so that it becomes a whole lot more manageable. So I'm going to go through this presentation. This is the second time I'm doing this by Zoom, and it is a little bit easier to do it directly in person, because a lot of this is having you guys not only listen to it, but also think about it in the context of your own projects. It is doable this way. We're gonna have some time afterwards to exercise this or to answer questions around it. But what works the best is you think about your project. You think about the things that you are doing, either a project that you've just completed, one that you're about to start, something that you're sitting on the 10th revision of the manuscript and you don't exactly know how to do it, and think along the lines of your particular project and how what we're talking about is going to apply. Okay, so there are 3 objectives to this presentation. We're going to review the prep work that is required to get started on manuscript writing, which really is quite important, because you don't want to go back to the prep work at the time if you're halfway done or at the very end. To conceptualize the core components of the scientific manuscript, including what it entails text-wise, figures, and tables, and then to build a transferable foolproof recipe for manuscript writing. And you will have your own recipe. Like there's 5 million recipes for the same dish. You will have the one that fits you the best, but I really strongly encourage you to think through it in the context of one project, because it does apply to the next and the next and the next project again. It is particularly helpful for people that have multiple responsibilities and very little time. So let me just go through the concept. So when you, let's say you have done your project, any project in your world, and I'm going to give you a few examples out of my world. So I'm very interested in inflammatory brain diseases, so diseases that are affecting the integrity and function of the child's brain. One condition is called vasculitis, and let's say we have 2 different treatment regimens for vasculitis, and we want to compare them and see which one is more effective. So really in an observational fashion, not a randomized controlled trial, although the recipe works for all kinds of quantitative research. So the prep work here is, you know who your team is, but be aware that you really know who your team is. So if you have partners that have grad students or so that need to be on the manuscript, make sure that you're not leaving anybody behind. They still need to have contributed to the work and to the manuscript, but just ensure, and I do that right in the beginning. I always open up a Word document. I put a date on it, and in the handout, it's dates and times are unbelievably important. Okay, make sure that every version you save does not have a thing of version 1, version 2, but has a time and a date. Because it happens every single time when we are not going with this this kind of approach, that somebody works on the wrong version. So just make sure that you open your document, you put a time and a date on it. If you have more people than yourself working on it, what I do is I also put my initials, so SB behind it, and I save it under this term. I write down my team. I list the team. I write down. I copy out the journal that I'm selecting, and so think about the journal. But the key thing is, which group of people do you really want the information to benefit from? And obviously we're trying to have a high impact journal that we're aiming for, but you only have one kick at the can. So what I would suggest is you pick a high impact journal that you think you have a chance to get in. And after that, you're not going through 5 million other journals. You go to one others that you're pretty sure that you're gonna get into. Okay, so that it just saves you time. Keep in mind that the reviewers of those journals are probably the same people. And if I get the 4th request from a different journal for the same paper, even though the level of the the journal may now be the right level, I do get annoyed, and I think everybody gets annoyed, because what you don't want to just basically go from journal to journal and submit the same thing again. Remember, the reviewers are the same people. So do one high impact journal. If they say no, forget it, then you go to the one that you think you're getting into anyways, and think about it really, really clearly. What is the audience for this paper? How does your paper potentially change care, and who should be the people that should know about it? Look at the author's guidelines of the journal you're going for, copy them out and have them on your first page, because you need to know how many words, what is the headline of each of those segments. Are there specific things like, for example, key points or impact of research? They all have a little bit of a different tweak. So just make sure that that you know where you're going, in which journal you're going, and what the guidance is. So you have a sense of, am I writing 3,000 words, or am I writing 4,200? And then you get a sense of how many words are there per page. So what I can tell you, for most of the manuscripts that I'm writing, I have 1.5 pages for introduction, 2 for methods, 2.5 for results, and 1.5 to 2 for discussions. We usually have 3 tables and 2 figures. You can obviously change that around and make it 5 tables, but keep in mind that tables are boring and pictures are good. So please have at least one eye candy, something that is a picture that somebody can use. critically make sure you have an EndNote program or any other reference manager program. Don't start without any of this. If any of you on the call does not have a reference program, I would suggest it's time to get one. Sorry, there are some comments. I just want to make sure that it's not has. Can you write a question?
Yeah, I would take care of the comments. The
Okay,
quickness.
super. I just want to make sure that you hear me. Okay,
yeah.
thanks, Koshik.
Yeah, no.
Okay, so write down your team, pick your journal, copy out the author's guideline, and definitely have a reference manager program. So I'm not sure if you know, but the libraries are all giving you courses of how to use EndNote, and EndNote is a super easy thing to do. So the next thing is on your, you want to have a title of what you're publishing. And I'm a big fan of titles that are somewhat more interesting than just the descriptor. And one way to do that is to put a colon between two parts of your title. So something like a descriptive component. So for example, treatment of CNS vasculitis, and then a colon, and then what your message is. So for example, what do I call it? Decreasing towards decreasing or towards a lower dose of cyclophosphamide or so. Something that makes me that is interesting. Something that that is real, but also has a component of really I'm interested in this. And on the first page, as you know, the authors you have to list the author affiliations, and they have to all be checked by your authors. Okay, but that's very much at the end. So the core of each paper is a very standard thing, and it's very much across all different journals. There's usually a background or introduction. Look at the author's guidelines, what their preferred way is, because you get anything you write with the wrong headline. Let's say the journal wants introduction and you wrote background. The first read of your manuscript is the editorial office. And that is a reason to bounce it back to you. So they're seeing, oh, you didn't follow the author's guidelines, and you get it back. And what it means is you have to resubmit it. And for those of you who are submitting papers, they know that the process of submission is a lengthy process. So don't make it harder for you. Just make sure that you understand in the journal that you're interested in, what are the author's guidelines, what are the headlines, what is the word count, and so forth. Some journals call it patients and methods, some call it methods alone. The results are usually results. There's oftentimes the headline discussion, some have discussions and conclusions, but just do it the way the guideline wants it. The references, as I said, you pull the references in out of a reference manager. Do not do it manually. It always ends up in a disaster. And then the concept of tables and figures. Sorry. So when you think about writing this paper, please don't start in the beginning. Do not start with, now I'm writing an abstract, or now I'm writing an introduction. You always start with your methods. The methods don't require any data, and you know exactly what you've done. And we're going to talk about the build of the methods. So the methods typically include, basically are a description of what you have done. What are the data you captured? How did you capture them? What kind of analysis did you do? What was the study time frame? All of those components. There is no interpretation. There is no content beyond the method in the method, okay? At the same time, or right after you wrote the methods, what you do is now, I personally create the tables first. So if you have 3 tables, the first table is a description of who your cohort are and what are the variables that are not of interest. The second one is all of your comparative variables. Anything you compare between 2 groups, or anything you compare between responders, non-responders, anything you compare between those that are exposed versus those that are not exposed, anything that, any of those variables, demographic and so forth, we talk about it. So my strategy is that I use all the data that I have and I put them in the tables. That makes it very long tables. And then I choose those data, I highlight those data that are relevant and put them into the text of results. So there is a little bit of overlap, but we're not repeating everything that's in the table in the text of the results. And everything that's completely unimportant, you also can put into the results text, saying something like, there was no difference for the variables A, B, C, D, E, F, G. The third, so you have then described your study, how you collected the data, how you analyzed them, and what these results are in both a table format and in a text format. And we're going to talk about what these entail. But be aware that these two components are very distinct. In the methods, there is no results. In the results, there is no discussion, interpretation, no suggestion or anything. It is just a pure reporting of the results. Okay. The discussion itself, we'll talk about how it's built up, is your option to use, to share the information that you've given us in results, and to highlight what you think is the most important results, or the most true important results, and how do they relate to the information that's out there in the literature. And then you go back to the introduction, and we will talk about how to build the introduction, because I can tell you every single time when I write a manuscript, I would have written the introduction very, very differently in the beginning as I would compare to the end, because there's always learning as you write the manuscript. There's always new concepts, new angles, and you need to set the stage for those in the introduction. And at the very, 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 very end, because then it's easy, you write an abstract that is a short version of your entire paper. Okay, so I hope everybody on the Zoom has a study in mind that they have done, they want to do, or they want to publish. I know you're all muted, so I can't check on you, but please go with your particular study. So you're now charged in doing step 1, which is writing your methods. It's actually really, really straightforward to write the methods. You can write the methods for any study really quickly. And that is because the methods have a very standardized script to it. So there are a total of typically 6 paragraphs in the methods. Each of those paragraphs just has a few sentences. Okay, so we're talking 2 or 3 sentences. So it's not we're not talking about writing, a super long text here. Remember, the methods on your manuscript are just about 2 pages. So how does it start? It starts with describing your setting. So your study design, the patient's inclusion, exclusion criteria, the data capture, and ethics. So I'm going to give you an example. We usually start with a prospective, retrospective, cross-sectional, whatever, a prospective cohort study of, now you're describing your patients, of children with CNS vasculitis, for example. So make sure that if you're talking about a cohort, you use the magic word of consecutive patients. So not selected patients, not the one that you could find, but consecutive patients. So what you're implying is everybody who comes through the door gets into this cohort. There's always going to be somebody that you're missing, but please write down a prospective cohort of consecutive children with CNS vasculitis or whatever disease you have between time point 1 and 2 was conducted. So we are telling them, the reason this is important is, as a reader, you want to know, is this setting comparable to the setting that I'm in? Therefore, is it generalizable? So a retrospective cohort study, a retrospective, whatever, a case control study of, now comes your disease and the time frame was conducted, was performed. Next, that's sentence 1. Sentence 2, the study included, so you can work with 1, 2, 3, 4. The study included children, 1, between the ages of 1 and 18, 2, who had a minimum follow-up of whatever, 12 months, 3, who had angioconfirmed CNS vasculitis based on X criteria. Okay, so this is my inclusion criteria. This next sentence says the study excluded, and you're now excluding those that you from the included pool that you're not gonna look at. So why could that be, that somebody is excluded in a prospective cohort? So typical things are they don't have enough follow-up. They have incomplete data. I wouldn't blame, but let's say you have an instrument that that is only that is in English, so you need it to be fluent in English, or it has a particular age limit to this. There's always two ways of setting it up. You can either say it in the positive way, namely, I included children for the ages of 6 to 12 years as number one, as number two, that are fluent in English at a grade 6 level, number three, that had complete imaging at time point 0-3-12 months. And that is a nicer way of doing it than saying, oh, and I excluded everybody who had incomplete imaging, because you imagine that the trust in your data is bigger if you are inclusive with defined criteria, rather than you creating criteria and then you look at, oh, and most of them don't fulfill the criteria. It always takes away from studies. So I would suggest define your inclusion criteria as good as you can, and only exclude those. Exclusion criteria are always a bit of a flaw of a study that you have to exclude. So if there's anything that must be excluded and you cannot include it in the inclusion criteria, then do it. So first sentence, this is an X study of that patient population between time point A, time point 2. Second, the study included patients with, now you're listing them as number 1, 2, 3, 4. The study excluded if you have any exclusion criteria. So now the next sentence is data capture. So think about a retrospective study. So many retrospective studies are chart reviews. So what it means is that if I were to go into the archive and pull everybody's chart who has CNS vasculitis, guess what? I'm going to have a large amount of incomplete data, right? I'm not, obviously, because the way we're doing our consoles is we're writing something down that is pertinent positives, but we don't necessarily write down everything that is a pertinent negative, which means you assume that they don't have a rash just because nobody bothered writing down they have a rash. If you have a structured instrument, let's say you have a particular case report form, a CRF, or you have a database that always, where you have to comment on a standardized set of data for every single patient, you can imagine the quality of those data is much higher. So if you do chart review, don't say anything to the data capture. Don't say, I went to the archive and got some charts. If you have a designated database, no matter if it's an Excel spreadsheet or if it's a fancy whatever Connect Care thing, you mentioned this here. You're basically saying data were captured in a designated research database, and if that database has a name, then give the name. It just means that the quality of your data, if it's observational research, the quality of your data is higher than if you didn't have a standard to it. And the last sentence is, the study was approved by the Institutional Ethics Board, and I would always put the number of your ethics approval in brackets, because as many of you know, the reviewers are asked, are you sure that this study had ethics? And if you put the sentence that a study was approved by the Ethics Board and put the number there, then there's no question. Every so often, there is a particular terminology like complies with the Helsinki Declaration or any of those that needs to go into this particular first paragraph. Make sure that you have this on your first page where I told you to copy the author's instruction, because otherwise, again, the editorial office reads it, sees that you don't have the sentence in there and bounces it back to you. So just make sure that you're aware. So this is the very standard first paragraph, easy peasy to write. The next 3 paragraphs are descriptions of your variables. So typically, these descriptions are demographic and clinical variables, laboratory investigation, any particular type of imaging tests, any particular type of treatment. if you have a specific instrument you're using, like health-related quality of life questionnaire, any kind of monitoring tool that you're using. So make sure that you don't go beyond 3 paragraphs. So group all of your variables. Remember, when you go to ethics, you always have to give them a list of your variables that you have. Group those variables in categories that are meaningful. So the most common way they are grouped are demographic and clinical variables, laboratory investigations, laboratory and other investigations, treatments, so for example. But that depends on your research question and what type of variables you choose. But this is the time where you're defining the flow of your paper, defining the categories of your paper, and they should be anchored in the data you collected. Each of those paragraphs describes the data that you're capturing. So for example, we're taking the first of the 3 paragraphs, the paragraph 2, we say, yeah, let's say we're calling it demographic variables and demographic and clinical variables. So you start your sentence with saying, for example, demographic variables included, and you guys are neonatologists, so for example, I mean, you have those terminologies better, but gestational age, you know, anything that, anything related to ethnicity, gender, anything. You may want to have a category of pregnancy. You want to have a perinatal period or any of those, but make sure that you conceptualize those variables in groups and then describe those groups. The 5th paragraph of the methods is the outcome paragraph, and I strongly encourage you to label this paragraph outcome. It's really annoying if you have to read through the manuscript or through the methods and have to figure out what is their primary outcome. Is there any primary outcome here? Because they didn't distinguish the independent and the dependent variables. So independent is everything you've written in paragraph 2 to 4, sorry, and in paragraph 5, you're now telling me what is the outcome of your study, and label the paragraph in the methods outcome. So what it is a description now that follows that describes what was your primary outcome and what were your many secondary outcomes. And there's nothing wrong with saying the primary outcome of the study was. So the outcome is either a state of something, life or death, recovery, any particular status. If the status is a clear status, like so for example, survival, you don't need to define this. But if you have an outcome that requires a descriptor, so for example, let's say in the CNS vasculitis study that I'm kind of making up here, the outcome would be neurological recovery. So what does that mean, neurological recovery? Does it mean you have no neurological deficit? And if you don't have a neurological deficit, how do you measure a neurological deficit? So make sure you write down primary outcome. The primary study outcome was neurological recovery, defined by pediatric stroke outcome measures, including the categories of none to mild or something. So I need to get a sense of how do you define your outcome. The secondary outcomes are typically a list of different items. This could be health-related quality of life. This could be, in your case, a time to outcome like feeding, complications, infections, safety outcomes, all of those. List them and put them into an order that makes sense, okay? And you don't give any data here. You're just describing what are the outcomes of this particular study that you are interested in. You pick one as your primary outcome and all of the others the secondary outcomes. The last paragraph is the analysis paragraph, and I would call it analysis. So you're not telling them what you do with your data. You're just telling them what kind of tests you use. So if you look at the level of testing, typically the 3 levels of testing are, or the 3 levels of analysis are descriptive, comparative, and predictive for the most part, which means in the descriptive, the first sentence is descriptive statistics, including means, medians, ranges, percentages, any of those were computed. If you have a comparative part, you're going to tell them comparative analysis included, let's say t-test, chi-squared, whatever kind of strategy you take. You can be even less specific in saying, as you know, there's a difference between normally distributed data and non-normally distributed data. So normally distributed data are, for example, height, weight, any of those. Non-normally distributed data are, for example, scales. So for anything that is normally distributed, you need to use a parametric test. For everything that's not normally distributed, you use a non-parametric test. They're pretty much the same, the types of tests, they just have different names. So if you want to say for comparative analysis, you use parametric and non-parametric tests as appropriate. It just means you don't have to tell them if you take Wilcoxon rank log or whatever other test. That's good enough for this paragraph. And the last one, the last sentence, if you have fancier analysis, let's say a Kaplan-Meier analysis or a time to event analysis in any other way, a hazard rate ratio, for example, or you want to develop a prediction model, a logistic regression model, that is what you put into the last one, namely predictive analysis was done using logistic regression or something. So this is the core of your paper. Okay, this one page is the core of your paper. You're telling them the setting of your study, the variables you're collecting, grouped into 3 groups of independent variables. You're telling them what the outcome of your study is, and you're telling them what kind of analytic tests you're doing. So now you have headlines, right? You have headlines for the paragraphs 2 to 4. The first paragraph, we were at the results. Remember, I told you that I would now take all of those data that you described in the methods, all of those data, and put them into 3 tables. The first table being the table that has to do with who is my population. The second table, what was my main comparison. And the third table, you can highlight either the last part of the analysis, let's say you have a regression model you want to put in there, or you have a Kaplan-Meier curve and you make a graph instead. Or you want to highlight, let's say, effectiveness versus toxicity, or you have a particular emphasis. Let's say your intervention has a particular outcome. Let's say you want to have you have a growth outcome or an infection outcome. You may want to separate this from your second list that has all different types of variables and highlight that in a third table. So now you can read your own data, because now what you're going to say is, I'm reporting on the data that I collected and analyzed. So in the results, the first paragraph is the paragraph that corresponds to your study design paragraph. So the first paragraph will be saying, who are my patients? So you could start up with a total of 36 patients were included in the study. These were whatever number of boys, whatever number of girls. The median age of the group was X, and the range, whatever the range was. You may want to put the ethnicity in there, or the any pregnancy related thing, anything that characterizes your specific cohort really well. The next 3 paragraphs are now a report on the variables that you define. So let's say the first one was related to demographics and clinical findings. So now you're telling me what these were. And again, the details are in the tables. The highlight of what you find goes into the paragraph, and the stuff that was irrelevant also goes in the paragraph. There was no difference found for variables A, B, C, D, E. You repeat this for each of those paragraphs. The key thing is the last 2 paragraphs, the outcome and the analytic paragraph, they kind of merge together, because now you're telling them the clue of your study. And I would not give the headline of outcome. I would give a headline of what is the thing. So for example, if in my study a particular treatment there's a comparison between two treatments, and the clue of my thing was that I decreased toxicity, then I could make up a headline that captures this comparison of treatment toxicity. And then you describe the results of this particular component. So when I read a paper and I look at the methods, at the results, the first one tells me how many patients are in there, how old are they, how generalizable is this. The second, third, and fourth are telling me, okay, what was the clinical phenotype? What kind of testing results have they seen? What kind of whatever else you want. But the last paragraph tells me what the key analysis is that you did. So a comparison between different feeding strategies, a comparison between different ventilation strategies. Give it a headline that every reader knows where to look at. So what you have right now is the absolute critical pieces of your paper. You've told us what kind of data, what kind of setting, what kind of data, what kind of analysis, and your methods. And correspondingly, you tell us these were the patients, these were the clinical findings, these were the imaging findings, whatever it is, and this is the core information. Each of those paragraphs should not be longer than 4 sentences. So think about going back to the housewives concept. If I think about how much time do I need to write the methods, I can probably do that in 4 hours. So what I do is I take the page, I put headlines of groupings in it, and then I write the sentences for each of those different groupings. So demographic clinical variables, imaging features, treatment plans or treatment regimens. It doesn't really take a whole lot of thinking. You just have to make sure that everything you've collected in your study is actually reflected in the methods. Then I put the tables together, highlight what I think needs to go into the text because it's important or entirely unimportant, and then write the results. That piece, again, let's say you conceptually have 5 paragraphs of results. The first one is easy to write, which is who are your patients. The other one, you may need a little bit more time, perhaps for the entire results. Independent of the table, you need 2 hours, but with the table, you probably need 4. So what we have now is your study. Your study is done. Your study is conceptualized. Your study is completed. The next step is to decide what of those are the 2 critically important new pieces of information. Okay, I'm just going to go to the discussion. So the discussion has a total of 5 paragraphs. We talked about it before. It should absolutely not be longer, by all means not be longer than 2 pages. So that means that each of those paragraphs, and you have 5 paragraphs, each of them should not be longer than at most 4, in some instances, if you're a short sentence writer, 5 sentences. So here's how I built the discussion. The first paragraph is the summary that highlights the uniqueness of your study. So you're saying this was the first comprehensive analysis of whatever you did. This was the largest study. This was the think about the uniqueness of it. What is it that your study has done? It may not be the largest, but it may be the most comprehensive one. It may be a particular measure that you used that was used for the first time. So that's your intro statement. Then you have 3 sentences, and these are not terribly long sentences. 3 sentences to report this. So you're telling me this is the first comprehensive study of this new treatment in this particular patient group. Then you give me 3 sentences that is a bit of a summary of the results. The study identified a distinct phenotype of X, and you can put a number in it. Don't repeat all of your results, but just 3 sentences that make me believe that your first sentence, namely this study is new and important because of X, is in fact validated. So now we're coming to the actual discussion. So the actual discussion is 2 paragraphs, key point 1 and key point 2. So let's say I figure out in my study that a regimen with little cyclophosphamide is equally effective but is less toxic. So how do I deal with this message? I could make toxicity and effectiveness 2 paragraphs. So I could say regimen B is equally effective to regimen A. And then regimen B was safer than regimen A. So then it's 1 key point 1, 1 key point 2. In terms of drama, most people put the more important one first, but there's no rule of this. You basically just have to give me the elevator conversation. So I'm going to ask you, hey, you completed your study. What came out of it? So you have 8 floors to tell me in an elevator, to tell me what came out of the study. You're going to say, yeah, you know what? That was a great study. It was really important. We found that A and B. And then I can walk out on floor 8 and I say, this is interesting. So this is not a trivial thing. It's not an easy task to do. And that's why you have your friends and colleagues to at the point when you decide what are the 2 key messages, I would strongly suggest to run it by your team, run it by your colleagues. Have them ask you the question, what are the 2 messages that you get out of here? But let's say you find your first message. Your first message, let's say treatment A and treatment B were equally effective. So that's my making the point, sentence A, sentence 1. There's nothing wrong, start with the statement. Both treatment regimens were equally effective. Now the second sentence is supporting this point. Okay, so you use your data to support this point. You're saying 1 in 4 children in group, or equally in both groups, 38% achieved remission or achieved a state of inactive disease at the primary study endpoint. So that's the point you're making. You're making the statement, you're supporting the point. The next 3 sentences, max, are sentences that are looking at the reference. How does, at the references, at the literature, how does this statement that you made, how does it compare to anything that's out in the literature? So is there perhaps another team that has done a similar study? You may want to quote them. Keep in mind that the reviewers are picked based on the type of study that you do and the type of information that you're generating. So the chances are super high that if you are doing a study in my area, that I'm going to be your reviewer or you're going to be my reviewer. So if there is another study that was done that was similar or somewhat similar, your best bet is to relate your results to the results of this study and quote the study. So for each of those 3 sentences where you're reflecting on your findings in the context of the literature, make sure that you have the key studies, because these are your reviewers, the key studies referenced there. It doesn't mean that you have 20 references. It means that you probably have at most 5, okay, per paragraph. This is where your references more or less start. So the concept here is, I find something, this is what I find, and this is what this study found, this is different, and now you can judge, right? It's your discussion. You can say, this is is similar to what this study found, or this is very different, or this stands in contrast to this. When you find something similar, you don't need to justify it. When you find something in contrast, you have to give a sense of why that could be. Oftentimes, the same study doesn't exist because you've done something new. So you may want to think about what is your comparator here? Is it a different age group? Is it a different treatment? The key thing is it has to be relevant. It has to be for somebody who reads it. It needs to, you're saying, this is the result of my study. Here's the proof. And my results are seen in the context of the published literature. Same as this, very different from this, but they included more younger patients. This stands in contrast to this study, but this was not a tertiary care center. It was a different setting or so different care environment. So think about this, and you end this paragraph with what I call a motherhood statement, because you're opening a can of worms. You're making a statement, supporting your statement, saying how that relates to all the other studies out there. So I, as a reader, want to know, what's your take on it? So what is your take on it? If let's say we're coming back to my statement of treatment A is as good as treatment B, as effective as treatment B, my motherhood statement, and again, these are carefully phrased, could be, you know, a lower dose regimen should be considered, perhaps in a particular group of patients or so. So give me a statement at the very end that allows me to put things, to hear what you think is the takeaway point. So we're doing exactly the same thing in key point 2. Let's say my key point 2 is one regimen is safer than the other. We had less toxicity. Then I make the point, I prove the point, saying while there were whatever serious infection in group A, 20% serious infection, we only had 3% of serious infection in group B. But then again, the same thing, how does it compare to studies that were published out there that have used perhaps the same treatment regimen or have used a different treatment regimen for the same population? Something that allows me to put things in perspective, each of them with a reference, and end with the motherhood statement. So for example, in children with the highest infection risk or retreated patients with high likelihood of infection, low dose should be the preferred way to go. Something along those lines. So you have summarized your data, you've made the key points in a very structured way. You're now going to the 4th paragraph, which is the limitation of the study. Please start the paragraph by saying there were several limitations to the study, okay? So if I'm a reviewer, the only way I leave you off the hook if I disagree with your study is when you acknowledge any of the limitations in this paragraph. So what are typical limitations? The limitations are limitations of sample size. So this was a small study, or there was a limited sample size. However, you make a colon and say, however, it was the largest systematic analysis published to date, or it is a focused environment in a tertiary care center, or it is a rare disease and therefore, you know, 16 children represent a very large sample. So the number of limitations that you're going to put forward is a max of 3. We don't want a full paper of, oh, this didn't work and this didn't work. If you have retrospective studies, there's always an acknowledgement of missing data. You have to, right? You have to make sure that that if you're missing a substantial amount of data, that you acknowledge this. You're still saying that these data are important because of whatever it is. So for example, this is a retrospective study, therefore we had areas of missing data. However, so what could it be that overcomes missing data? It could be that that in all relevant areas a near complete data set was available. So let's say you don't have all of the data on all of the lab tests, but it doesn't really matter exactly for your message. Or you could say that some data were imputed. That's always some people don't like that, meaning that that you basically statistically make up those data. So the questions for limitations are typically sample size in pediatrics, missing data in retrospective studies, generalizability. So are your are your result generalizable to a place in India, to a community hospital, or is it only your ivory tower that you're working in? Okay, so think about addressing those. If I'm a reviewer and I see that you recognize this limitation, I cannot kill your paper on this. Okay, I cannot say, oh, and by the way, you had missing data, or all the way the paper is not generalizable. If you don't acknowledge it, then that's the point that you're going to be hung dry on. And if it's a real limitation, it's actually the point where your paper is going to fail. So think very carefully about what, as a reviewer, will I doubt or will I have issues with? Is it because the sample size? Is it because of the follow-up time period? Is it because of the for follow-up, you always argue it's not a long follow-up, but it's an in-depth characterization for this for the study time frame, meaning it's not long, but it's very solid, very robust, and how generalizable is the study. So the last paragraph is, please don't do more than 3 sentences, but it's your wrap-up paragraph. So you can wrap up, it's more the conclusion paragraph. So what are you concluding? So you have 3 sentences to conclude. Typically, you conclude by going back to the beginning, that this condition is a life-threatening condition, that there's uncertainty, that there's a huge health impact, that the second sentence says that your study has contributed X, Y, and Z. And the third sentence is where you want to head. And don't tell them further studies need to be done. Yes, further studies need to be done, but you have to tell me what kind of studies. You could tell me that based on your data, a randomized controlled trial should be done. Based on your data, treatment regimens may need to be modified. Based on your study, multi-center evaluations across the spectrum of care should be considered or should be supported. Any of those, okay? So now you go back to the introduction. So the introduction is exactly 4 paragraphs. And the way the introduction is built in this cooking recipe, and again, this is just one of many recipes, but it's very structured. So it has the 4 paragraphs, the first one being the disease of interest, the second one, the problem of interest, the third one, the gap of knowledge, the fourth one, therefore the aims of the study were. So let's play through this. So what is your disease of interest? Let's say we're taking, I don't know a whole lot of neonatology, but I'm just making it up, and you be graceful with me. Let's say your disease of interest is neonatal jaundice. So the question is, why should I care about neonatal jaundice? I mean, as a neonatologist, obviously you do, but why should I care about this paper of neonatal jaundice? So now comes your first sentence that you have to spend probably an hour on Saturday before you feed your family with. You want to make a point that this is relevant. So why is something relevant? It's typically because it either is common, it has an individual strong impact, it is economically important. And if you don't have any of those arguments, go to the 1 in 4 rule. So what you're describing is, let's say you're looking at a condition that occurs in 1 in 4 children that gets discharged from hospital, or a complication. Although nobody has a clue how much that is in total numbers, it does give you a sense that you're anchoring at something. So neonatal jaundice, I'm sure, is a common condition. I'm sure it has a huge health economic burden. I'm sure is anxiety creating in parents, any of those. So the first sentence starts up with your disease of interest or condition of interest. And you now have 4 sentences total, including the first sentence, to describe why that is relevant. And I would highly recommend that you put a max of 5 references in here. And these references have to be contemporary and they have to be relevant, okay? Don't go on a tangent at the end of this paragraph when you're describing neonatal jaundice, because you want to get to the next point, which is your problem of interest. So what is it about neonatal jaundice that you studied? Let's say you studied a particular hydration regimen. You're probably going to think, well, where has she been for the last 20 years? But let's say there is a hydration strategy for neonatal jaundice. So the first paragraph starts up with neonatal jaundice is an economic, has a strong economic impact. So you're going to make an economic argument, for example. The second one starts with hydration regimens for neonatal jaundice, and now you're describing the ones that are out there. Again, 4 sentences, 5 references. The next paragraph talks about the gap of knowledge. So why did you do the study? Because there was something not known about what's the right one, or what's the, what's the role of a particular strategy. So in the next 3 sentences in the gap of knowledge paragraph, you're basically drafting what is unknown, because then in the next paragraph in the aims, you're going to say, this is what we're going to address. Therefore, the aims of the study were to describe a cohort of children discharged from hospital that present with neonatal jaundice, compare those that had treatment A with treatment B, and identify risk factors of neonatal jaundice, or identify early predictors of what the heck. So this is it's a very logical path you follow, a case that you make. I'm not sure if any of you have lawyers or so in your family, but that's exactly what they do every time. They construct a case. This is an important condition. This is an important problem of this condition. This is what we don't know about this problem in this condition, and therefore we need to study it. It sounds easy, but it's not, and it's in the clearer and less don't make the error of writing a long introduction, because the problem with the long introduction is that you try to put too much information in there that is oftentimes irrelevant. At the very end, that you've written all of those components, you're now writing your abstract. You know that the abstracts are typically structured abstracts. That means you need 1 sentence out of the background, 2 or 3 out of the methods, 2 or 3 out of the results, and 1 or 2 of the discussion. So be aware that each journal has some specific needs. Okay, some people want key points, some people want, or some journals want take-home messages. Some people have a component that says research in context. Make sure that you know this based on what you have on your first page, because after you've written the manuscript, you have to make either the key points or take-home messages or research in context. So now, let's say you've written your manuscript and you're going to send it to your co-authors. The first thing the co-authors will look at is what is the ranking or the list of the order of your authors. Everybody does that. So clearly you've written the paper, you're the first author. If you've done the work together with somebody who has contributed just as much as you do a shared first authorship. It just gives you the same reputation as if you have single first authorship. There's also the option for a shared last authorship. But if you have, let's say I'm doing a study together with neurology, and there's a neurology and a rheumatology fellow, so they get shared first authorship, we should take shared last authorship. The key thing is that in between, people are looking for their position. And if you have a long list of authors, what I would do is I would identify the key points that of contribution. So for example, study enrollment, data collection, manuscript writing, analysis. So these key components that have enabled you to complete the study and write the manuscript. So now you take the authors and give everybody a point for each of those, and you will come up with a number that is basically the order of your authors. We've written international recommendations for pediatric research in Europe with a very large group of people that are very opinionated and very high profile. And we shared this list and it was not an issue. I know that if we hadn't shared it, the components, we said this is the authors list, here are the criteria, how we decided on authors list. It was transparent. We said, if you have any concerns, please let us know. Nobody had a concern. And I'm doing this over and over, especially if you have a multidisciplinary team. I mean, if you have your 3 people, you can probably guess who did what and who should be on what position. But make sure that you have a very conscious process to decide the list of authors. Okay, you're sending it out to your co-authors, and you're gonna, before you send it, you do one thing. and so there's this typo in it. You have to read it loud, okay? Sit down before you send it and read it to yourself once out loud. Every single time I do this, I find something that sounds really silly, or a repetition of something, or something that is inconsistent that I called A in one and B in another area. So before you send it to your co-authors, before you have them spend time on something that you will benefit from, make sure that you read it to yourself once out loud. Then you send it to your co-authors with the request to send it back within 2 weeks. You give them a time and you say, here's our joint manuscript. Thank you for contributing. Thank you for enabling it. We are collecting. We would be delighted to get your feedback until Friday, July 14th. If you haven't responded by then, we're assuming that you're comfortable with the manuscript. Okay, so make sure that you're giving it a time frame, 2-week time frame. If somebody can't make it, they get back to you really quickly. They say, I'm so sorry, I'm on vacation. Can I have an extra week? And then it's up to you to decide, and you obviously give them another week. But you're not going to chase them. So if you have a list at home that everybody gets back to you July 13th, and whatever author F gets an extra week, that's fine. But if they don't respond, that you presume they're okay with the manuscript. When they give you feedback, which they do, you don't have to take everybody's opinion. Read through them really carefully and take those where you feel they're really making the manuscript better. And then you're submitting the manuscript, and the process of submission is a really lengthy process. It's a really lengthy process. For no matter which electronic system you use, you have to put their names and addresses and contact information and a letter, accompanying cover letter. It takes forever. So the process of submitting is the process that I usually need a half day for. Because one is I always read it before I read it out loud before I put it in, and the process itself takes a long time. Once you've submitted it, you get a PDF version, and you send this PDF version to everybody who is a co-author and said, the manuscript was submitted. Thanks very much for the fantastic support. We'll keep you posted. Okay, and then you have to wait for your review. If they don't reject it, the manuscript is in, no matter how many 5 million questions they have. If they don't reject it, no matter how annoying the comments are, you're going to get it in. If they do reject it, you go to the second journal that you had mapped out. And that's my presentation. I'm happy to take questions.
Thank you so much. That was amazing, Dr. Bensler. I have a couple of questions until people write their own. It's one of them is in general, as a young researcher, when you join the gang, and then you get like many more senior people approaches you, and for good intention, then they offer to include you in different kind of studies, and you get distracted, and it's hard for you to decide what to pick and which way to go. So any advice in that regard that you have?
Yeah, so I think the key thing is mentorship. The key thing is absolute mentorship. So when I started working at SIGKIDS, they made you decide on content mentors and career mentors. Unfortunately, we don't have this structure here in place right now, but it doesn't stop you from doing this. And I continue to do this because, you know, as a young person starting, you don't want to offend anybody, and you want to say yes to a lot of things, but you know, you only have so many hours in a day, and you can't lose yourself in everything. So when somebody approaches you and says, hey, it would be great if you could do this, I would say, wow, that sounds fantastic. Let me just talk to my mentor and make sure that that I can, you know, complete this really well, and that I should do this. So defer your response, and select people. So I'm just going to show you tell you what this difference is. So a content mentor is somebody who knows the area somewhat, but is not your supervisor. Okay, because you want somebody who gives you informed guidance without having an investment in you.
Okay.
The career mentor is a person that is not in your area, that has distance to your field, and typically you have two of each, but for sure one. So as a career mentor, you want to pick somebody whose career you kind of feel could be yours, or there are lots of components that could be yours, completely different areas. So it could be somebody in nephrology or in GI or whatever, but the likelihood that this person has faced the same anxiety, the same challenges, the same rejection, the same frustration is sky high, right? Because it's not you, it's the system that you struggle with.
Yeah.
So that's what I would do. I would be positive in my response, but I would definitely anchor my decisions in a conversation with my mentor. The other piece about the mentorship, it is unbelievably helpful to have a structured mentorship relationship, and the onus of the work is done by the mentee. So if you were to come to me and say, could you mentor me? Then I would expect that every 6 months you're booking an appointment with me where you come and you bring what you've achieved in the last 6 months and discuss the key points that you want my input with. Obviously, if something goes wrong, if you need help right away, you reach out at any time. But what oftentimes happens is that people ask for mentorship and then make no effort whatsoever of connecting and setting up these meetings. So I still have mentors that I have for my times of fellowship or young staff that still expect that every 6 months I come and I tell them what I'm doing, what I'm struggling with. And, because we need mentors at every stage of our lives, because the challenges are just different, they don't go away.
Yeah, that's very, very true. And related to that, like more like specifically, like I found there were two schools of thoughts when it comes to research and publication. When I came, like some of my mentors were telling me, aim high impact journals and do like very high quality RCT and start high. And then there was another thought that said, like, you are in a race with the time, especially when you are a junior faculty, you better build your track record with the PubMed indexed publications to be able to get into those high impact journals. So what's your thought and your advice when it comes to
Yeah, I mean, I try to suggest is if you've done your study and you think it's fabulous and you think you have a kick at the can, you have one kick at the can. All of the high impact journals going to give you feedback in a super short time. The high impact journals, let's say New England Journal or JAMA, have a different word count. They have a smaller word count. That means if you go that path, you have to some extent rewrite your manuscript for your kind of mid-level journal. So there were 2 times in 20 years that I submitted to New England Journal. Both times we got rejected. So you have to be prepared that you have to basically double your word count. You have to rewrite the whole 9 yards. Think about the work impact. I personally think if you're sure that it has a chance, try. But in principle, especially in clinical research, there's nothing wrong with having mid-level manuscripts, lots of mid-level manuscripts. If you have a top-notch study or an RCT nobody's ever done before, give it a try once, but be prepared that if it is rejected and it gets rejected in less than 2 weeks, if it gets rejected, that you pick it up and don't wait a day to resubmit, but that means that you have to rewrite a whole lot of it. Don't let it sit. Okay, the worst thing is that people submit, get rejected, and then put it on a whatever shelf, because then it's worth nothing. Then it's better if you had all along put it into a journal where you had a really good chance getting it in.
That's a great advice. I have a specific question here, Kim. It's like regarding the first draft when you send it to the co-authors and
Yeah,
then you got their feedback. Do you
yeah.
need to send them the revised version or you
No,
can address
no,
it and submit it?
no. One round.
Okay,
One
good.
round.
Okay.
Yeah, no, you're in charge, and if you have a second person, let's say you're a junior first author and you have a more senior last author, let this person read it, but you're not going back a second time around. Everybody reviews papers once, they don't go back. You're sending them the version that you submitted, but but one is they have one round of suggestion, and two, it's up to you which of those you take.
Okay, and there's one question regarding the reviewers' comments. How do you deal with when you come, as you said, like if the paper is not rejected, it's in, but
Okay, so this is
sometimes,
the yeah, this is an art form
yeah,
that is almost as good as Buddhist meditation. Okay,
okay,
seriously,
yeah,
seriously, seriously, seriously. I mean, this is one of the things where so let's say, so you're killing them with detail, okay? Killing them with friendliness in detail. Nobody tolerates 8 pages of response, but that's exactly what you're going to give them, okay? So what you're going to do is you're going to make a list of all of the reviewers' comments. And if it's 21, then you say 1, 2, and so forth. You list the comment they make. You say for each of them, thank you very much for the comment. We incorporated the suggestions into the manuscript, and then you copy the sentence that you changed or the paragraph that you wrote in there and put in page 7. Okay, you never argue. Okay, you make each point a thank you very much. Thank you for the kind feedback. Thank you for raising the important point. Thank you for pointing this out. We incorporated your suggestion in the manuscript or something along those lines, okay? There's never gonna be a doubt that you did what they want, no matter if you did it or not. And it goes point by point by point, okay? Nobody as a reviewer tolerates this. So they basically, if you give me 8 pages back with everything that I criticized, I'm going to say fine, okay? If you give me a half page back that says, oh, I really don't like your comment, I'm going to argue it, okay?
yeah.
So you take the oh, and by the way, even if you don't believe that he's right or she's right, it's typically men, sorry guys, even if you don't believe he's right, you got to do it, okay? It's Buddhist meditation. You don't argue, okay? You do not argue. If this reviewer, the problem arises if you have 2 people asking for different things around the same thing, but then you have the option of writing to the editorial office, which I've done many times, and say, can you just guide me with this conflict? This is the point. These are the 2 suggestions. I took the liberty of going with this suggestions. Is that okay? And then it goes in. Yeah.
Yes,
But,
that, yeah.
but never, if they don't reject it, you have the paper in. The only thing you have to do is swallow your pride and kill them with friendliness and detail. Okay. That's all you need to do.
That's a great advice. And then the last request I have here is for the scoring system that you're talking about for the authorship.
Yeah.
Do you have it written? Are you willing to share it with the audience?
I'm happy to share it. It's not rocket science, but it really is it is a bit. I can give you what I have, but it really is. Think about the key components when you look at your list of authors. What have they helped you with? Sorry, some have helped you recruiting patients. Some have helped you entering data. Some have helped you doing the analysis and so forth. Each of those is a point, right? If somebody has done many different things or has played a major role, it becomes an additive high number, right? So for example, in the recommendation, it was an iterative process. If somebody has responded to survey 1, survey 2, has reviewed the manuscript, those kinds of things, you get a point for each of those. I can send you the ones that I have, but it's really helpful because it's very hard to argue. And I've actually never seen anybody arguing that, because what they realize is that some other people have done more, or they hadn't responded to whatever, or they haven't really contributed to the data collection or to the analysis. It just makes it very transparent.